We're back. I'd like to make a motion to come out of executive session.
I second.
All in favor, say aye.
Aye.
Aye, ayes have it. All right, I'd also like to make a motion to schedule a special session to further review personnel issues.
I second.
All right, all in favor, say aye.
Aye.
All right, we will be moving forward with another executive session to further discuss personnel issues. All right, we did receive the financial update from Cox Holiday. We're gonna move on to unfinished business and we're back on the rails. Brandon, what you got?
So actually for unfinished business, status of our IT switch over. Actually, that's gonna happen on December 22nd, starting at 9:30. Tech Advisor is going to be taking over. WBOT is coming in at 9:30 to kind of take us off of that system. And then from that point on, the rest of that day, possibly into the next, we'll be going on to our new system, our standalone IT service system through Tech Advisors. So we're up and running. If you go through actually the news section here at the formerly Red Cross rooms that we will now be taking over, they have a terminal here for us. You'll see a couple little new things in the ceiling above my understanding.
Tech Advisors have already started to work.
Already started to work, yep. And so we're geared up, ready to go. So the length of it would be, the lengthy part will be them coming in, wiping us off of the OT system, and then taking out all of their hardware so we can put all the new hardware in. Tech Advisor has started a little bit of that too, in the spacing, but it's a lot of wiring. If you go back there and look, it looks like a jumbled mess.
Yeah, I'd
So,
like to see it.
Yeah, by all means.
All of the data is on the cloud, so you're gonna have access to all of your health department data.
Yes, absolutely. All of that between web-based services that we use already anyway, so there's no lagging on that aspect. We are still staying with Google Mail through West Virginia OT. So all of our data on the Google Drives are going to be there until the end of the fiscal year, when we're no longer paying for it retroactively, and we'll be moving to our own separate, and everything will still be able to on the cloud for us, even afterwards.
All right, great.
So
Thank you, Nathan. Happy
Thank you.
holidays.
thanks, sir.
Pleasure seeing you. And then phones remain operational?
The phones will be remaining operational. Those are actually through the county. I say operational, we always have our I think because of the building, a little bit of it, so a little bit of issues here and there with it. The county does an amazing job trying to maintain that we still keep our phones up and running.
But not any scheduled downtime?
No scheduled downtime.
Due to this, okay.
And we'll actually still have wireless internet, minus maybe Tech Advisor said for about an hour. So we would still be able to log in, even if we use our personal laptops, something up to our web-based services if we need to. So we'll still have access to things during this time.
Thank you.
Yep.
Any other questions or comments on the IT switchover? All right. New business?
That's our activity report.
No.
Oh, okay. Thank you. So, yeah, we did want to discuss the possibility of updating in environmental health fees for fiscal year 27. That would go into effect 1 July. Taking a look at some of the fees, I know when I started, the fees were set. They had, correct me if I'm wrong here with the timeline. Prior to me, I think the June before I got here, they had set a pay fee scale and based it off of 20% of what the fee was in general at the time, right?
I believe it was a 20% across the board.
It wasn't across the board, it was a close to
It was
across
close,
the board.
Close.
it was
Okay.
close to that, but
There was some exceptions.
Yeah.
Few.
Taking into consideration the obvious cost increase of the time and effort and everything else that we have, we wanted to take a look at our fees now and where we stand comparatively to also other counties. And certain fees and certain things that we do, that the amount of time it takes for our individuals, our sanitarians to do that work, if it is a cost-effective fee. Did that make any sense? Meaning,
I've always thought they needed to be based on the time spent for those
Exactly.
services.
and that's what we want to look at. And so we wanted to get the discussion out there about that. To begin with, we looked at the average amount, cost-wise per hour for sanitarians. And then we're looking at how much time it would take each, service, there we go, thank you.
Yes.
What it would, time-wise, how much, so we'll base our fees off that.
So I'll have final calculations to present to you at the January meeting. At which point I believe we would then, I would recommend that the board consider putting it out for public comment, to then have public comments considered, come February, so that the timeline would move forward. If the board is so chooses to approve it, to go into effect on July 1st, which is what we did the previous time.
And we are not looking also to raise all the fees, right? We're looking at
Correct.
fees, and there may be some fees that we actually lower because of cost effectiveness, right? He talked about that, one to even out some of that burden to the county.
Yeah.
Additionally, because it may also not be as,
Dr. Reedy, didn't we push some of those fees forward because they were sort of state mandated?
So prior to, so the spring, almost 2 years ago, when Gillian was here, the state used to set the fee schedule, and they decided to stop being involved in that and push it all to the counties. And there was a rapid turnaround time that we had, all the counties had to do it. They had like 6 weeks, but because you have to then get it approved by the county in addition to us, we just went through our little change, but it was a big deal. There were no public comments, I think, on the fee change. So it went, pretty well. And there was discussion, even I think one of the sitting commissioners at that time made a comment that these probably need to be increased. And that's just what we had inflation and everything else. And we've just last meeting talked about increasing sanitarian salaries because of we've had, since those fees were set, we had 2 sanitarians leave last November for 20,000 more in Loudoun County. So it's we do need to adjust it just because our costs have changed. But yeah, so it went pretty straightforward. Our fees are not an exorbitant part of building a home. For
Right.
example.
I remember when we did I guess it's been 2 years now, it seems like it's a little more recent than that, but that sounds about right too. I know there was some talk that it had been a while since these had been, maybe the issue was because of the state was mandating them, and so they never got adjusted, but to me, as we look at doing this, like, do we build in a cadence of an annual review process where we have the opportunity to review and update rates every year? And kind of bake that in as an expectation that, we're not just gonna set this and then 4 months later realize, 4 years later, we've got a big update, but that every year these are reviewed. We are doing our analysis. We have a method to it. We're not just picking numbers.
Mhm.
And expect to see a public comment each year for the annual update to inspections fees. It might only be 2%. It might just be a cost of living
Yeah.
update, but it might be also a bigger update in some instances.
I think for that is actually a necessary thing to do is to annually look at certain things within our budget, right? Like the fee schedules, even when it comes to clinical, these sorts of things, what are we doing? While we are not a business, we still need to function.
Yeah.
And take into consideration certain things that even if it is to save money at the end, right? The individual's money in the county, right? If we look at it and say, oh, no, these are we can make that adjustment back in, right? And this isn't just to raise prices. That's something I want to make sure is perfectly clear. We're not trying to raise prices just to the sake of raising prices. We're also want to look at how we can be more effective across the board for the county in all ways
Mhm.
with that.
Yeah, and I think messaging it as an annual update, an
Mhm.
annual review and update process.
Yes.
Public comment on it.
Absolutely.
I think January is the perfect time to do it.
Yeah.
You gotta, it's because then that data will be available when you set your budget a few months later.
Right.
So it would be based on the anticipated change.
And when invoices go out, the invoices are future.
Yeah, so
Right,
we
you
would
can-
invoice in April first, so as long as the fees are approved prior to April first. Then we would be able to adjust the invoices prior to the July 1 date, which is when they would then be due. We send them April first, they're due July first.
Got it.
I thought it was May first. Was it April?
It may have been May first in the past, but I think that we've done April first just to try to get ahead of it as we've grown. Cause there's so many of them.
Let's see. April's when it was sent out.
Yeah.
So that's
Last year.
when it's sent out. It's sometime in April. I don't know the date as far as showing up in our QuickBooks as but it may have been late, but they're not due until the new permit year starts.
Yeah.
My reasoning of asking was because we're gonna have to have the public comment.
Yes.
And then we're gonna have to have another meeting, and then it has to go to the
Yeah.
county commission agenda to get on it to be voted on
Yep.
before it. And then does it come back to us to be totally enacted after the county, or does our vote to send it to the county, is that the final vote from the board?
So our vote that sends it to the county
Right,
is the final vote for the board. Once it goes to the county, if they approve it, then
then it's
then
done.
it's done. They have to be notarized, other
Okay.
things, and then it should be
Okay.
good to go after that, much like with our sanitarian reasons. Yeah,
But yeah, it may work out that they go out in May, and that's fine.
Yeah, I was thinking the same. If we have to delay a month,
Yeah.
then so be it.
Yeah.
Okay. All right, anything else on the updating environmental health fees? The board will look for a proposal next January or next month.
next month we'll have some more empirical data and fees.
And if you could come up with the draft messaging for the public comment,
Absolutely.
I'd like to review that.
Absolutely.
It's potential if we do this in January, which is the second comes relatively early. But there's a 5-week period for the next regular meeting. So we need 30 days to announce the special session, potentially have that 2 days before the February meeting.
Oh, I see.
We'll look at
Just to
that.
give us a little bit of,
Gives you a little breathing room with
Yeah,
the
yeah.
county commission.
we can look at that. All
Absolutely.
right. All right, nothing else. Let's move on to the activity reports.
Alrighty, so this month, actually, sorry, we're in November, but I'm thinking December already. For the month of November, we did start to see those septic numbers start to normalize. They're still a little bit higher, than what I would consider normal for this time of year. In the 30s in terms of applications that are coming in and site visits that we're doing. But I do think that that's gonna drop off. We still had pretty good weather in the month of November, so we were still seeing a good bit of demand for our services. Inspection wise, we responded to several complaints in the month of November. Most of those were able to be resolved. Some of them are still pending investigation. The inspection totals were above average. We do have 3 sanitarians that are able to do all inspections, and then we have our newly hired sanitarian who is about halfway through her online training, and then who will be prepared to begin to go to the on-site training in February. The Board of Sanitarians met in November. They certified all of our continued education hours for our sanitarians, so they will be eligible to renew their licensure. So there'll be no issues with going into the next year. As well as they did discuss the sanitarian training that we've been having an ongoing conversation about. They voted, if I recall, the meeting minutes unfortunately are not available. And I did request them, but I was told that it could be several months before they're available because they were not put on the agenda for the next meeting to be voted on. So the way that I understand is they're several months behind on approval of minutes, and the most recent minutes available are from May. Again, I put the request in and we'll see what happens. I will keep poking and see what I can get. But from memory, they did make a motion to consider removing the college degree requirement. And they met with the director of the Cabell Huntington Health Department in order to discuss the legislative process that would need to take place for that. So there's some legislative items that will come up on the upcoming January session that will pertain to the sanitarian training. As soon as I get what those bills will look like, I'll take a look at them and then I will update you guys, if anything will affect our department. But other than that, I have no further update.
So latest on is it radon? Like you were a couple months ago talking about the radon. I'm just kind of curious,
Yes.
so what's the latest with that?
So we finally got our application finalized. It bounced back 3 times because of typos. But it was finally approved and we finally have access to the funds, up to $10,000 for, the grant period beginning October 1st and ending, next year. So I've ordered 200 test kits. They should arrive next week. As soon as I have them, together, administration will make a plan to figure out how we're going to distribute them. We're probably going to be putting, I've been very active on our social media lately. I've been trying to engage in the public, and try to make them aware of what services we have and that kind of thing. So I'll probably make some sort of post that states that we have them in-house, and I'll have them available in our lobby for people to take on a day-to-day basis. And then we'll make a plan to attend some events in person, to do some education, maybe some health fairs. Obviously, we'll be doing the Jefferson County Fair next summer that we'll attend and bring those out to. But in-house, I'm also using that funding to conduct a sanitarian specific training. Part of that grant involves working with the Jefferson County daycare facilities, because we want to target children that would be affected by radon exposure. So I've created a training for the sanitarians to basically understand what radon is and how to educate the childcare facilities, because we conduct about 35 childcare inspections per year. So every time they do an inspection, they will be able to walk through, have you guys had your facility tested for radon? If not, you can get a test kit for free at the health department, and we will help you to understand what those results are and make a plan in place if they were to come back high. So that training is going to actually take place next Tuesday with the sanitarians. And then beginning next calendar year, when we start our normal inspection period, they will then have the tools that they need and the test kits will come in and we will be able to help our community. So I'm very, very excited about it. I'm thrilled. I'm hoping that everybody else is too. I know the sanitarians are, so.
And you could come to Rotary and speak about that as
I
well.
would love to.
We'll make
That
that
would be
happen.
awesome. Thank you. Love to do that. Yeah. That's the update.
Appreciate it. Nicole, Lindsay?
Yes, our numbers are where we're expecting at this time of the year. childhood vaccines have dropped, schools have already started, and then flu vaccines and COVID vaccines are what we're seeing, picking up. And all the numbers pretty much look where we expect them to be. I don't really have anything else to add. Our QRT team is always busy. They're out and about. A lot of requests for their help. So if they're, once we got this new room here to put in a lot of their not equipment, but things, their resources, we've gotten a lot more people coming in needing it. It's just the more resources we have, the more people are coming through. So it's been good to see that.
All right, thank you. Appreciate it, Lindsay. Right, health officer report, Dr. Reed?
So following on the flu and COVID, we've done fewer vaccines this year, which is not a big surprise, always a disappointment when we have less, but but we're still doing this, and it's still not too late to get your flu vaccine. The flu has started, and there are cases, showing up at the hospital, the emergency department. Flu, COVID, and RSV the last few weeks have been showing up. No surge like a couple of years ago, but it's a little too early to say what's going to happen, if this is going to start causing lots of hospitalizations or not. The state used to have a dashboard that would show the cases of these. I no longer find that when I look for it on the state dashboard. There's still a federal dashboard that looks at the flu rates. If vulnerable people get the flu or COVID, they should reach out to their practitioner or go to urgent care. There are medications that can help decrease the seriousness of it. So it's not something you just have to put up with, but if you're at greater risk of complications. I attended the Public Health Advisory Committee, which is a state committee with different representatives, a few county commissioners, I think some board members, as well as different health officers and state employees. The two topics that they discussed, this was at the beginning of this month, were ones that we have pushed, and the one is the sanitarian training. And the issue was not exactly the sanitarian training, it was about the capacity for health departments to meet all of the required services that will be evaluated this spring or late winter here for the yearly evaluation of the state. One place that a large number of health departments were deficient in, as were we, is not completing all of the required health inspections of facilities. And it quickly came to, it's hard to keep sanitarians, and it's hard to recruit them, and it's hard to train them because of the current setup. And then it became quite bureaucratic about how you change things. But sometimes out here, we don't realize that the problems we have actually are, everyone's having the same thing. It's not that we're uniquely unable to do stuff. These have become problems for everyone. So there was some information of other health, at least one other health department that has board members that are interested in this, and so we're trying to get some linkages, and did send to Karen one contact number. The West Virginia Association of Local Health Departments was meeting the next day, and stayed for that, and that's so Brandon usually goes to that. And he'll be doing that most months, but that's a major topic there. A number of the people on that leadership are sanitarians and administrators that worked for a long time. So it's a big issue because the process is very slow, as we've talked about here, but it continues to be an issue that part of our program plan to address the deficiency was to address this as a state level. So at least we're making some headway. It hasn't resolved yet. Issues such as how the sanitarian board is functioning become a part of it too. If the minutes are in arrears, stuff like that, that's a problem. The other issue that they discussed was, which we have been vocal to the state about, the problem when the state has a state public health laboratory, which most states do. Back decades ago, the early part of the last century, public health labs in the state was the best labs anywhere because no one else invested in it. Now, of course, you've got LabCorp and Quest and all sorts of Mayo Clinic, all these other lab corporations that have huge revenues and equipment and service capacity. We send some things to the State Office of Laboratory Service because it's required, such as if we have a head of an animal to test for rabies, we have to send that to the state lab. That's who does it. And it has to be sent by FedEx overnight. So some things we are required to send there because that's the only place we can get it done. There's some infections, such as a foodborne infection, where specimens need to be sent there for subtyping or culture, as opposed to being sent to LabCorp. Most clinical specimens, so someone came in to be screened for infections, we could send them to a commercial laboratory, but it wouldn't be free. Whereas if we send, for certain types of specimens, if we send them to the state, especially sexually transmitted infections, it will be processed for free. But we still have to pay the cost of FedExing it there. The problem that's happened in the last year that we thought was uniquely us because of our location is that a number of the specimens that have to be refrigerated are not getting there at the temperature that they were to be at, and that's the issues that they're required now to have a temperature monitor that accompanies it that shows if it stayed in the temperature range. So if it takes too long to get there, especially in the summer, it may be out of temperature range. Turns out certain types of serology or blood specimens, about half of our specimens are not getting tested because they don't get their temperature range. FedEx, my understanding is all of their specimens go to the hub in Memphis and are sorted and come back. I have no idea how it actually, what all the stops it has to get back to Charleston, but it's often not within 24 hours. There become a number of technical issues, such as they're open from 8 till 4 or 8 to 5, 5 days a week, unless it's a holiday. So that limits when we can send it and expect it to get there. There are questions, there are a lot of questions, but it turns out even health centers an hour away from Charleston have the same problem. So trying to figure out how we provide the services and people actually get a result finally from their specimen is something we've opened that Pandora's box. But it becomes a real question on affordability of essential services. We are required to provide sexually transmitted disease testing. For people to get it through their own health insurance sometimes is $400 or $500 or more, because that's just what it costs. And that all comes out of their deductible, and then people will just decide not to get tested. So it's a it's an issue, but it turns out it's all the other health departments are having the same issues. So that was brought up, no resolution, but we're gonna keep pushing on it. Because it's and this is something that, you know, we're gonna be trying to collect data, and do this as much as possible through a quality improvement, data-driven process. And we are looking at other ways of testing. Some people we are sending their specimens to commercial laboratories. There are some specimens we can do on site with rapid tests that may be more affordable. And but so those are the main issues.
It'd be interesting to see how they resolve that with FedEx.
It's not worked well.
Yeah.
So FedEx, my understanding, and this all becomes speaking with one representative and then a different one, and it's not like this is our case manager who works with us. So they have a contract with the state for special rates. United Parcel won't even discuss, they don't even they do an initial call and then they don't return back to that. It's like, no, we aren't even touching this. So there's a better system that could keep them at refrigerator, but the cost starts getting high, like towards $100 a shipment, which it's like so we'll be looking with LabCorp for special rates. Some of the health departments have got that. The trouble then is that the special rates is they charge us for it, and then we have to try and collect it from the patient, which we know how that goes. So it's a good problem,
Yeah, thank you.
but it matters for people.
All right, anything else?
Okay.
Administrator report?
Speaking of FedEx, one of the big issues with that was them coming here and picking up by the time they actually ship it out. A lot of times it becomes out of range, it takes too long because they're coming to pick it up here. When we were having an issue earlier, when I would take the shipping to FedEx in either Hagerstown or Frederick, since I live up that way, and that's the closest area, it gets there quickly. So on Wednesdays in the afternoons, I'll be taking FedEx shippings to the FedEx facilities, in Hagerstown or Frederick, since I'm going right by there. It's very simple for me. It's not an issue, and they get there on time. So we're trying to alleviate that system now, so we're not redrawing blood multiple times on an individual. So that's a kind of a quick workaround for that as it stands now. We're still looking, and Dr. Reset looking into alternatives, but for now, that's kind of our fix. A lot of fun stuff coming up, a lot of different things coming up, but to go into something we talked about earlier, MMSWB, we started at the beginning of the month. They come on Wednesdays to pick up all of our bills for the week. So far we've sent out, 2 weeks now, almost 3, maybe a week of bills. I don't even remember what week we're in December. So we'll hopefully see good result in how that's going to look here, maybe within a month or so, of how that is. Again, we talked about them talking to them again as far as our old bills. So we're getting there. Myself, Dr. Reedy, Commissioner Heffestay, and John Breslin of the LEPC met with State Senator Rucker and State Delegate Rittenhour yesterday to go across the mountain at Shenandoah area to look at possible fire emergency evacuation sites. And I'm thankful I was able to go because I'll be the only one on 4-wheel drive, and there's no way that some of them, I don't know how some of the folks live up that way without 4-wheel drive. So it was a good time, about good 3 hours running around the mountain. Glad I got to put the 4-wheel drive into use on the truck. I don't get to use it always, so it was a great time. I met with the JCCM, the new director at JCCM the other day as well. Got to meet with her. She's coming from Goodwill and the entire region. The Horizons place up in Hagerstown seems to have a lot of great ideas, a lot of changing of the culture that she wants to make, so which is going to be interesting. Really wants to work with partnership with us and our QRT team, which is going to be awesome. So one of the things we also want to just bring up or talk about was we have had obviously issues here and there, everything. We new staff member, insurance, getting her up and running, finally got her up and running with insurance. Unfortunate aspect is they don't take, her physician doesn't take PIA. So always a sad time, but we were finally able to get her up and running with insurance, get her scheduled and started up. So which is awesome time. Glad that I was able to do that and get her situated. We've been starting management meetings on Fridays for the management staff. So we meet every Friday afternoon. Additionally, which you got to sit in on, we are doing Monday, Wednesday, and Friday all staff huddles. So this way we are kind of meeting real quick, talking about things, keeping up to date on everything. So sometimes if I go talk, it's easier than putting out an email for me and trying to list everybody out on the email, and it's able, this way I can answer questions rightfully if there's something going on. Like our luncheon. So I want to invite everybody out there to our luncheon on December 22nd. It's going to be here. Since we do have a little bit of time with the OT switchover, we're going to do our Christmas luncheon Monday, the 22nd, about noon. It's going to be catered by Patty Yarmouth. Hey, it's Greek. I barely speak English properly. I speak Latin at first. So they're going to cater the event. We're also going to do a cookie exchange and a door decorating contest. So by all means, please feel free to come out, hang out with us, grab some gyros, chicken skewers, Greek salads, and cookies. I will be making my cookies. Thank you very much. Additionally, on that day, I will be getting hopefully floor plans for the new facility, updated floor plans for the new facility, hopefully by next week. And that afternoon, I wanted to take the staff, and obviously everybody's still invited to go over to the new facility and kind of get to picture walls in the new facility to kind of see the space that we have, how big it is, and kind of get a scope of it, along with hopefully the new floor plan, and to discuss that and see what works for them, how they feel about it. Obviously, this is not going to be the end all be all for the floor plan. We still need to meet with them some more, but get their input on these things, get their ideas. And then additionally, in the day, they get to see how far of a drive home it's going to be from that facility for the new spot. So it's kind of a all encompassing event. So feel free if you're able to, more than welcome. Invite is always out there for everybody.
So what is the work schedule that week of Christmas?
So the week of Christmas, it is Monday, Tuesday, Wednesday, half a day.
Okay.
And then same way with the following week, I do believe.
Closed Thursday and Friday.
Correct.
Okay.
I do believe so. I will double check with that though.
So the 26th and the 2nd, we are open, so the Friday.
Oh, we are, okay.
Oh, you are open?
Unless the governor, well, actually, unless the county commission closes us.
Yeah.
So the governor can give state employees off, we're not state employees, so county commission says we're closed, we would be closed then. More likely, what happens is the governor and would say state employees are off all of the 24th instead of half day on Christmas Eve or New Year's Eve. So that everyone pretty much is accustomed to the half day. And what often happens is the late afternoon on the day before, the governor will say, you've got off tomorrow. So what happens is most health departments the same way, is they're not even scheduling people that day because you guess how likely it is we're going to be open, and so it's going to, but Christmas is often a pretty, those 2 weeks are often pretty slow in the health department. There's even if it happens on a
So
Saturday.
what's the 26th?
Brother,
The status of the 26th? We're open?
So it's not a holiday that I know of.
I'll have to check with the county on that.
because then that would make a long weekend or 5-day weekend.
But hearing conflicting reports from the county, so I'll go verify.
So back to the
Yes, ma'am.
new office
Yes, ma'am.
facilities. Laura and I both
Yes.
been on a tour of that,
Yes.
and it's going to be very, very nice.
I am looking forward to it.
Lots of light.
Yes, I think the initial plan too is the one giant window area by the entrance
Mhm.
doorway that they're going to put the hallway in is to be possibly a waiting room, which would be amazing for patients to have natural light coming in and so I think that would a good time. Again, we'll wait to see what the new floor plans are. I don't want to jump the gun on excitement on things, everything is always a work in progress. But I think it's going to be regardless of the situation, it's going to be a great facility and it's going to be a great location that we get to actually help individuals in town. And it's bus stop is going to be right there. You will be right there, everything. So be good. And a nice big conference room for all of our meetings. We got a little bit better chairs too. So I'm looking forward to it. Yeah, and that's pretty much been the update for right now. Again, the month is the holiday month. I think a lot of folks have felt not staff wise, but in the area, you always go around holiday months after Thanksgiving. It's always kind of one of those. I'm here. Everybody's rushing around, so we're trying to get in the doldrums of the winter. That's it on my end.
All right. Well, what's your sense of timing when the actual move will take place?
Oh, depends on who you ask, how they will. Like I say, my personal sense of timing, about a year and a half. Rough estimate. Just from historically dealing with individuals, contractors, we don't have a set floor plan yet. We've been 3-4 iterations of the floor plan, Dr. Edie.
Yeah, I think they had hoped to have the architectural stuff done by the end of October, and we're not there. We will probably be the last office moved in there, because ours has been the most complicated because our rooms need to be soundproofed. And this is just a large space with high ceilings. So you're gonna have to look at ventilation for each of the rooms. Everything in there was cubicles, pretty much. So you're gonna have to look at your lighting, and it's on a slab, so any plumbing has to be made into that concrete slab. So it gets more complicated.
But it's interesting, they have little trap drawers every so many feet where all of the technology stuff and the plumbing stuff comes through, so that they do have access to getting to this.
Yeah.
That was a really interesting observation with the tour, that it was built for technology changes.
Interesting. Yeah, it's very modular.
It's just unfortunately for us, where a lot of the facilities that are there, that are going to be in there, take the assessor's office, things like that, they just need offices. And really not a whole lot, mainly a lot of sitting down a meeting area type of thing. For us, it's a very complex integrated area where between bathrooms, hand washing stations, sinks for sinks in the patient rooms, to again soundproofing, to medicine rooms, and all of these different things. I realistically like to say about a year and a half, just as from historically dealing with architects and construction of nature of this.
Some of these other offices, I think the goal was March or
Yes.
April.
Yes.
One of the complications or considerations since this was first proposed is that the day report center, which deals with people on probation for drug issues that need ongoing therapy, they ended up closing as of July 1st. So this year, those services are actually being done by the Berkeley County Day Report Center. This is a large number of people that they take care of. But as of July of this coming year, Jefferson County is going to offer those services, and they've taken some of the space that we were going to have to provide that service, but they really do not have a full plan of how that's going to be, and so our available space keeps changing. Berkeley County's day report started with a very small space, went to a prior Kmart or something. They went to a large store and filled that, and then the past 2 years they've expanded so much that they've built 2 stories above that. So the amount of space that they have in there is, could be way under what they need by the time they're in there. Sort of like building schools in this area. By the time the school's open, you need to put trailers outside.
All right. That concludes our agenda item. I'd like to ask for a motion to adjourn.
I move we adjourn.
Second. Any discussion? All right, all in favor, say aye.
Aye.
Aye. All right, thank